What's up, everybody? Coach Ben podcast here with Jim from Jiu-Jitsu Magazine. What's up, Jim?
Oh, it's just another sunny Southern California day here at Muscle Farm HQ. Glad everyone's here with us. Glad to be with you, Coach. We had something recently pop up in Jiu-Jitsu world. Kenan Duarte positive for P.E.D, that's performance-enhancing drug use, and they have stripped him of his 2019 world title. However, you have some thoughts on this matter and may not be as guilty as public opinion would kind of make him out to be. Is that correct?
Yeah. Well, let's first look at what happened, right? So Kynan tested positive for Osterine, which is a SARM. We'll talk about more what a SARM is later. But basically, he tested positive on June 2nd of 2019, right? So long story short, they gave him a 1-year suspension from that date. So he's eligible to compete again in June of this year. And basically what happened was he tested positive for trace amounts of Osterine, also known as MK2866, also known as EMBO-SARM. And what it is basically it's called a selective androgen receptor modulator. Okay, it's one of those. And it's an experimental drug. It's not approved for use. Right, so yes, it is illegal. You cannot take this, but kind of what happened was he cooperated with USADA, spent his own money to test possible tainted supplements, and USADA basically found that Kynan, there was a person close to Kynan that possessed a product that was cross-contaminated with Osterine, right? So that he was found, I guess, not guilty of intentional use, right? It was a contaminated supplement. Despite all this, he has to obviously face the consequences. You're still responsible for what you put in your body. So he forfeits the 2019 IBJJF World Championship. Leandro Lo becomes world champion, and yeah. So that's just what it is. I'm just reading off what USADA has said, right? So let's talk about what a SARM is. It's basically it's a drug, right? It's a drug that hasn't really been approved for human usage. It's been tested on, I think, like animals, monkeys, things like that. And it's a SARM is basically like a weaker anabolic steroid. So it's oral ingestion, so you eat it as opposed to injected in fat or muscle tissue.
Okay.
So it's kind of like there are certain anabolic steroids that you do also orally ingest, like Anavar is like one of them. But the effects are similar to testosterone for this specific SARM, Osterine. So similar to anabolic steroids, but with milder androgenic side effects. So meaning it'll give you the growth of the muscle, bone, and probably other things that you don't want growing. But it has less androgenic side effects, so like hair loss, like estrogen production, things like that.
Like
right?
gynecomastia.
Gynecomastia, yeah.
gyno.
So yeah, I think there may be risks for gyno, but I would say lesser so than like testosterone or well not really testosterone, but other steroids.
Okay.
Right. So SARMs prohibited by WADA since 2008. So since 2008, SARMs have been prohibited, illegal to use, and they have been used for performance enhancement. Right.
So we're going real quick. I want to stop you right there. We're going pretty deep into acronyms. So WADA is World Anti-Doping Agency.
Yeah.
Or Association Agency.
Yeah, agency.
And then what's a SARM?
SARM is it's basically a drug that acts similar to testosterone.
Okay.
With milder side effects.
Okay.
Yeah, there's a lot of names for them.
Okay.
But basically, it's a performance enhancing drug. Right.
All
So
right.
Kynan tested positive for trace amounts. Okay. Now this is where things get kind of murky.
Okay.
Right. If you look at the sanctions for just I'm only using a UFC sanction. So for USADA, so UFC.usada.org, and then there's a tab for sanctions. It's very, very inconsistent on how they are kind of dealing out the punishment, right? So there was a period of time where bunch of athletes just popped for Osterine, and it was all unintentional use. So they did not mean to. It was a contaminated supplement. So Sean O'Malley, Marvin Vittori, Augusto Mendez, Nico Montano, these are all people that have got 6-month suspensions for unintentional use. So they were kind of exonerated from, I guess, intentionally cheating, right? And then if you go back, there's Tom Lawler. Literally the same thing happened to him, but he had 2 years. He essentially ruined his career, right? And if you look at this list of sanctions, like, I'm not the biggest expert on anabolic steroids or anything, but I can tell almost right away what looks like it's kind of like a like a contaminated supplement, and what is a intentional use. You're cheating. Okay, so I mean, USADA is pretty consistent in that aspect. Like, for example, people that have been tested positive for EPO, right? That's like 2 years. They're going to get 2-year suspension, right?
Okay.
If they test positive for, like, I'm not to single anybody out, but I'm just bringing up Ben Rothwell, right? Testosterone, 2-year suspension. You don't really. It's weird because certain athletes that test positive for Osterine, they get 2-year suspension. Some get 6 months. Some it's unintentional. Like, here's one for Khabib's teammate Zubaira Turkugov, and he took. It looks like he took Osterine, right? And he got suspended 2 years. Now, I don't think went through the process that Kynan did to kind of clear his name, but either way, I'm just looking at it, and it's not very in line. It's not always in line, okay? But what we do know are facts, right? So facts are Kynan tested positive. He ended up spending his own money to test possible tainted supplements, and they found that his teammate had tainted supplement, and he ingested it. So he had to provide like a closed, sealed container of probably a bunch of stuff, and then spend his own money to test it. And then USADA came to their independent conclusion that he was not guilty of intentional use, right? So why are we bringing this up? The reason is because online I've been seeing a lot of this. I think he's been kind of unfairly treated, right? So people are saying, "Oh, you're a cheater. We knew it all along. We knew you're on steroids all along." And excuse me, but I may get into angry mode soon because this kind of stuff annoys me.
Okay.
Especially when people in their
livelihood,
grandma's basement is commenting on somebody that's at the top of the hill. Like,
right.
What value do you bring by saying these things?
Right.
Especially when the evidence doesn't support what it is. So you're using an eyeball test, right? So I already mentioned Marvin Vittori, Sean O'Malley, all these guys. Well, you know who else is in there?
Well, let's pause on that. Explain to people what the eyeball test is. What do you mean?
I will. I'm just going to bring up another person.
Okay.
Nate Diaz is in here.
Okay.
Right? So Nate Diaz tested positive for Osterine, and then they found in his supplement that he makes. By the way, he's like one of the owners of the company, I think, or he at least has an interest in the company. Not only had Osterine and another SARM, it had also an anabolic steroid. So people that say, "Oh, tainted supplements," just an excuse. Is Nate Diaz making the same excuse? So if you're going to excuse Nate Diaz of any intentional use, and he's a clean athlete, everybody's on steroids. He's the guy that says that, right? Then how can you say Kynan is for sure on steroids, right? You can't. You're just looking at their bodies. You're looking at eyeballs, right? And I can tell you right now that the eyeball test is very unreliable.
Okay.
Right. So eyeball test is basically, I look at you, you look jacked, so you must be on anabolic steroids.
Yeah, fill in the blank.
Yeah, I mean, so
well, yeah,
and there's no way.
And then on the other side of that coin, if anyone remembers Tim Sylvia, the UFC heavyweight champ at one point, he got popped for anabolic
Josh
steroids.
Barnett.
And they're not what you would consider body beautifuls.
No, Fabricio Verdum. Does he look like he's on steroids? No, but he got popped for legitimate use.
These are legit
2-year
pops.
suspension.
Yeah,
these are legit. Well, Josh Barnett is a little bit dubious, but Tim Sylvia, I think. I'm on shaky ground here. I don't remember too much of it. But another example, you could also go the other way. Yoel Romero, right? Everybody thinks he's on steroids. He looks super jacked. He has never tested positive for anything except a tainted supplement in which the same process happened. In fact, he sued the company for like $40 million and won.
And won, yeah.
You know, so again, you cannot use the eyeball test. Why? I'll tell you why. Well, one is you never know, right? So how do you know? What are you looking for? You know, this is not like, it's not like, you know, this person has veins on their face or their body, or they turn red. Okay, they're on something. Are they on something? Maybe they have high blood pressure. You know, maybe they have really good genetics, right? I've trained athletes who I know for a fact they weren't on anabolic steroids because they couldn't afford it. They couldn't afford me. You know, they couldn't afford anything. They couldn't afford food. But you take a picture of them with good lighting, you know, low body fat, and throw it online, and 8 out of 10 people may say they're on steroids, but it's just not fair to say that, because I'm telling you they're not. You know, so again, eyeball test, very unreliable, and more importantly, adds no value. Right at the end of the day, you know, you're a guy on the internet saying, you know, everyone's on steroids. This guy's on steroids. You know, speculating. What value does that bring to the community of jiu-jitsu? You know, it's pointless. Like, at the end of the day, there's no, like, what do you hope to accomplish by telling people that Kynan is on steroids because he failed a test for tainted supplement, right? What do you get for attacking, you know, I'll just throw out some things that I've heard all the time. You know, oh well, all the Brazilians are on steroids, or Atos, you know, all that stuff. It's like, are they? I don't know. Maybe not. Okay, you can't, but you can't say everybody's on them. That's the problem. The problem is when you say everybody's on steroids, that's just false. It's speculation, right?
Right.
And so now I'm gonna, you know, there's a fine line too. You know, so I'll talk about, you know, the last thing we'll talk about is kind of like the fine line between like integrity and honesty and sport, you know, and a competitive advantage. But first, I just want to go into like my own experiences, right? So, you know, I have no problem telling people that I was once on TRT, testosterone replacement therapy, right? I had elbow surgery in my mid-30s, and you know, I you know, was told by my doctor and my coach that I needed to do it. I started off as a cream, put it on your balls, below your balls, and you know, that was that. Then I couldn't do that anymore because you know, there was just like some, I guess we did some tests and there was not consistent, you know, so we ended up doing the injection.
Okay.
Injection was first in my leg, and then it just hurt too bad I couldn't take it anymore, so we started doing it in the stomach fat, right? So testosterone, this is just regular testosterone, and I can tell you right now that it wasn't like game changing. You know, I don't even think it did much, to be honest. And of course, I'm on therapeutic doses, you know, for, I guess, quote unquote, low testosterone.
Okay, what does that mean, therapeutic doses?
Means like it's to replace what you should have.
Normal levels.
Yeah.
So it's not skyrocketing your body into the stratosphere.
Right.
Got it.
Right. But there were times, there was like a 3-month period. I was only on it for like three or 4 months. That I, like, you know what, today I'm going to, hard training, so I'm going to put a little more in. You know, it is what it is, you know. And yeah, they did send you more of it than you needed, which I think is kind of dubious.
They're winking a nod.
But I can tell you right now that it was not like, you know, you're not going to be world champion. You know, like, I trained very hard, and you're not. Genetics, work ethic, a little bit of luck. You know, a lot of things are involved in the success of an athlete. Okay, if you want to say Kynan won the worlds or 180cc because of trace amounts of O-strain, you got to be kidding me. Like, there's no way. And you know, back real quick, I'm going to come back to my example. Kynan travels a ton, right? He's like out of town. He's out in other countries all the time. You know how hard it is to you know, travel with steroids and needles and all these things with you all the time. You know, it's just not, it's not practical. You know, so based on the evidence, based on, you know, I don't know him very well. I had him over for a seminar once, and you know, I know who he is. Is he on steroids? I don't know, but who cares? You know, that's I guess the point is, why speculate? The evidence says that he did something that was inadvertent, stick to the evidence. Don't use your eyeball test
from experts.
Exactly. You're using your eyeball test because to be honest, it's a little bit of ego. It's ego. People feel bad about not being as good as him. So, well, he must be steroids. It must be. He can't possibly be that good, that young, and that talented. I'm not even close to him. So he must have this special help. And to me, that's just garbage. It's just egotistical, and at best, whatever makes you feel better, bro. It doesn't make me feel better. When I say that, it's more like I realize right away that I'm compensating, right? So I never use the eyeball test. I never speculate people are on steroids. I stick to the facts. Now, back to what I was saying about my experience with them. I've never used SARMs. Okay, when I was kind of in my prime, I don't think they even existed. But let's see, what else did I use? I have used Andro one time in high school. It was a long time ago. Pretty effective. Put on a lot of weight. But again, I was playing football at the time. Did I make it even to like a D1 college? No. It's not going to change your course.
It's not contract or sponsorship in a vial, is what you're saying.
No, it's not even close. I'm trying to think of if there's anything else I did that was had like anabolic components to it. And Andro, TRT, and that's it. I had teammates at one point who were doing things, and I just I just didn't feel like I just didn't feel like I was at the level to kind of even be messing with that stuff. I wasn't even sleeping enough. You're talking about doing anabolic drugs. Most people they can take all the anabolic steroids in the world and they won't even make it to ADCC. Doesn't matter how old you are. And to accuse these kids of being on stuff when you have zero evidence is just wrong. And people will say, "Oh, well, how you're so naive." Look at his team. Look at blah blah blah. I don't give a shit. Okay, it's not naive. It's just it's called critical thinking. It's sticking to the facts. Now, if something is blatantly obvious, I have by then maybe I can. There's a fine line, right? So I'm going to get to that fine line. The fine line is just here is if you're selling stuff, right, and then claiming to be natural, that's an integrity issue that I can't support, But Kynan has never done that. What does he do? He goes, he competes, he wins, he makes money, he does seminars, he's teaching jiu-jitsu moves. He's not selling, a pill. He's not selling supplements. He's not selling anything that's going to make you look like him. He's not saying that if you go to his seminar, you're going to be just as good as him. He's just teaching moves and being an athlete, and is everybody else on steroids? Who cares? Maybe not, probably not, unlikely, so anyway, I kind of ranted there, but yeah, there's just one caveat to all of this, which is, yes, there are people out there who will intentionally lie about being a clean athlete and then make a career off of that and be taking steroids, at home and never tell anybody, right? Those are usually people in the fitness industry, actually. Okay, and I don't have any evidence that anybody in the fitness industry does that, but there's just been enough like speculation that I think it for sure happens. In jiu-jitsu, are people on steroids? Are people on performance enhancing drugs? 100%. Absolutely. Yeah. Can we speculate who is and who isn't? No.
We'll leave that to the experts.
Yeah, it's none of your business, really.
Yeah, and it's not like there's so much money in jiu-jitsu competition that they're bribing WADA and USADA officials.
Okay, let me tell you something that I do know. I know for a fact that there's masters competitors out there who are on testosterone replacement and other stuff to win medals at IBJJF regional tournaments. I know for a fact because I talk to these people, But again, if I didn't know them personally and I didn't, I was just a guy on the internet, I wouldn't speculate.
You wouldn't be any of the wiser.
No, I wouldn't. If they didn't tell me, directly in my face, like I'd be like, well, you're just a guy that trains hard and you're ripped at 50 years old. But, it's possible. There's people out there. Have you seen Laird Hamilton? This guy,
surfer, former pro surfer,
he's like
jiu-jitsu
50
black belt.
years old. Yeah, he's not jiu-jitsu black belt.
Wait, no, Joel.
You're talking
Tudor.
about Joel Tudor.
Yeah,
Joel definitely doesn't look like he's on steroids. But anyway, like it just, again, the point I'm trying to make in all this is that it is wrong to accuse anybody of being on anything, and it's usually people, online trolls, who are just haters. They're not happy with. They feel like there's some kind of injustice, right? What injustice is there? If you think everybody's on steroids, then great. Then he's just doing what everybody is doing. If you think that he has some kind of special advantage, then prove it. Prove that he took something that gave him a performance enhancing advantage. Because USADA has said itself that it only contained trace. He took something that contained trace amounts of Osterine. There's one last thing. Osterine, the 24-hour half-life. Okay, it gets out of your system in 24 hours. That's not true, first of all. And secondly, even a specific dose, if you ingest, any peptide, these types of things, it can store in your fat cells. So you might pass a bunch of tests, and then all of a sudden, that tainted protein you took like 2 months ago that had Osterine in it just comes out. Boom, fat cells release a little bit of it, you test positive. All right, and that's why USADA has nowadays kind of changed their thresholds, right? So now you have to kind of test positive for quite a lot of it. But again, I don't know what the rules are right now. I'm not an expert on this. So that's it. That's all I got to really say about this P.E.D thing in jiu-jitsu. I'll just leave it at this. By accusing people of being on P.E.Ds, what value do you add to the jiu-jitsu community? What do you get, except for maybe making yourself feel a little better? Mm-hmm. What is there? I mean, can you help me with that, Jim? Like, what?
Well, no, I guess I would just say, are you? How much do you really care about that? And what do you think the end product of your call out? Not your Ben's, but the people who talk like this. What do you think the end result of their call out is going to be without any action? What are you going to do outside of just verbally, getting loose with the lips? Yeah. Calling people out. There's really nothing good
Especially
that comes
if you're
of
not
it.
a competitor.
Especially if you're not a competitor.
If you're Keenan or you're Roberto Jimenez and you compete with these guys regularly, all right, I get it. I understand.
Well,
because you're kind of being fooled.
Well, and I mean, it just comes down to this, what you mentioned a little earlier, your critical thinking.
Yeah.
It's like, where is your critical thinking? And with all this and everything you said, I would just, I guess a good recommendation of action would be go to the USADA website.
Yeah.
Learn more about the protocol, the methods, and how this stuff works.
Yeah.
Have a better understanding of how this stuff works before going out and attacking people.
Right.
It's just bad mojo, man.
Yeah, I challenge people to tell me that leave in the comments, right? Put comments, just say I'll engage.
Let's have a discussion.
Let's have a discussion. If you tell me that calling out young jiu-jitsu competitors who may or may not be on anabolic steroids or performance enhancing drugs somehow benefits the community as a whole, please explain how.
Yeah, and to this point, I think it's safe to say that, given the circumstances, you and me don't endorse people who take illegal substances or banned substances to try to beat or try to win. It's cheating, right? We don't endorse cheating, but at the same time, we do ask for a little bit of understanding. It's our intent to ask for understanding and encourage the discussion and encourage people, ourselves included, to learn a little bit more about this, and then move forward on thoughtful action.
Yeah, I mean, definitely kids should not be messing with this.
Absolutely.
Adults, you do whatever you want with your own body, and I'm not encouraging the use of it. But again, you're not discouraging people from using it when you call people out online. You're probably actually encouraging the use of it, because people are going to see that and be like, oh, well, well, Kynan just popped for this Osterring. I can just go online and buy this stuff. And next thing you know, you have just been the catalyst for somebody actually starting, because you created that conversation, right? What there's people out there, there's people in my academy actually that they were at the seminar with Kynan when I brought them to my academy, and they didn't even know what a SARM is. Guess what? Now they do. Guess what? No, I'm not going to sugarcoat it. We're just going to be honest. Can you buy SARMs online legally right now for research purposes? Yes, you can legally. So it's just one of these things where it brings no value, and I'm just going to end it at that. Okay.
All right, well, very good. So if anyone wants to know more about this stuff, once again, go to the USADA website. They deal specifically about competition and context, learn some context about this subject matter. And also you can keep in touch with Coach Ben himself on Instagram at Coach BZ.
Yep.
That's Bravo Zulu.
Don't use the eyeball test.
Don't use the eyeball test, everyone. All right, from me, Jiu-Jitsu Mag, Muscle Farm HQ, thank you.